Hi, good morning Eugene. My name is Elisha Winnick. I'm your invigilator for the OET speaking session conducting on the 18th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Eugene Cotes.
And what is your candidate number, please?
My candidate number is 233268198.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Would you rather be liked, or respected, as a nurse?
In most work roles, being respected should be given greater emphasis since it is typically linked more closely to competence and productivity. But, a significant factor to consider is the nature of your relationship with your colleagues. However, in my opinion, being respected is important when it comes to the professional area. Respected personalities will also be liked by everyone.
What's your process for handling several tasks at once, while still providing great customer care?
I've spent many years working in a hospital setting, so I am very familiar with the intensity of being assigned several tasks at once. I'll take a deep breath and prioritize each task, in order of importance and critical care, that's needed of me. I try to keep a pen and paper, to quickly write down each patient I need to see, to ensure I don't forget each task. I'll start with critically ill or injured patients who need care right away. I'll meet with them and finish up my tasks as quickly as possible, while being careful not to make any errors.
Do you find that communication skills are important for a nurse?
Communication and interpersonal skills are of the utmost importance. Nurses must communicate effectively with senior medical personnel and colleagues. 2. Nurses must especially be good at communicating with patients and their beloved ones. Nurses should be able to explain the concepts and situations clearly, yet without upsetting patients and bystanders unnecessarily.
What type of work environment do you prefer?
I do well in a range of work environments, but I think the environments I've enjoyed most in my career are smaller organizations, where I can focus on giving great care to each patient that comes in, without feeling rushed.
Nursing can be stressful. How do you handle stress in your life?
Over the past couple of years, I've been practicing breathing exercises and meditation. Both have been very effective in reducing stress while on the job, and after a shift. I also like to exercise regularly by going to the gym and doing yoga. Finally, I spend time in nature when I'm not working. I've found that's a great stress reducer.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good evening. My name's Eugene Cotes. One of the nurses working here. How may I address you?
Hi, my name is Elisha Winnick.
Hi, Elisha. May I know what brings you here today?
My son got injured with a rusty nail.
Oh, I'm really sorry to hear that. Have you done the first aid?
I just pulled out the nail from his hand.
All right. May I have his name and age for the record, please?
Yes, his name is Warner Hawks. And he is just 4 years old.
Thank you, Elisha. Well, let me have a look at his wound. Meanwhile, could you please explain to me what has happened actually?
The accident happened about 25 minutes ago at the local park. Warner put his hand through a rusty nail when he picked up a plank of wood to play with. It was me who removed his hand from the nail.
Thank you, Elisha, for your briefing. From my examination, Warner's hand should be cleaned properly and dress the wound. Also, he will need a tetanus injection.
Well, nurse, I don't want my son to receive the tetanus injection now because it's too stressful.
Elisha, I can understand what is on your mind now. But for better knowledge, may I know whether your son got a childhood vaccination?
No. He didn't receive it. Actually, I forgot to bring him for his childhood vaccination.
Oh. I am really sorry, Elisha. Your son needs the injection immediately. As the child did not receive the vaccination as part of the childhood vaccination program, he is unprotected from tetanus. Also, on examining the injury, it seems to be a deep wound. Hence, the chance of foreign bodies being present inside the wound is high. An immediate vaccination is very necessary.
Oh, really? Okay. But nurse, I would like to have my husband to come here after work, to support me.
Elisha, don't get nervous. We are here to care for your son, and to support you as well. Please listen to my words.
Yes, nurse. But...
Elisha, please listen to me. I'm not panicking you. What I am trying to convey to you is the seriousness of having the vaccination. Okay.
All right. I know it, nurse.
Now listen to me carefully. Let me explain to you so that you will understand the seriousness of the condition.
Okay.
Tetanus bacteria usually enter the body through a dirty puncture wound, cut, scrape, or some other break in the skin. Once inside the skin, they multiply and produce a toxin, or poison, that affects the body's nerves. This toxin causes severe muscle spasms, cramps, and seizures. Spasms in the jaw muscles produce lockjaw. Spasms also occur in muscles of the throat, chest, abdomen, and extremities. If you don't receive proper treatment, the toxin's effect on respiratory muscles can interfere with breathing. If this happens, it may even lead to death due to suffocation. A tetanus infection may develop after almost any type of skin injury, major or minor. Did you get me, Elisha?
Oh God. I haven't heard of these many complications. I understand completely about the need for injection now.
Great. But don't worry, your son is in our safe hands. Nothing will happen wrong. Immediate vaccination is a must. I reassure you that your son will be perfectly all right.
Okay, nurse. I agree with you.
Thank you, Elisha, for your cooperation and understanding. Shall I proceed taking his vaccination?
Okay. All right.
Vaccination is done successfully. Elisha, in rare cases, some side effects are being spotted after having tetanus vaccination. Nothing to worry about. Side effects include mild fever, joint pain, muscle aches, nausea, tiredness, or pain, itching, swelling, redness at the injection site may occur. If any of these effects persist or worsen, consult the doctor.
Okay, nurse.
I wish him a speedy recovery.
Thank you, nurse.
You are welcome.
That is the end of your OHE speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.